I am Dr. A.K. Pancholia from Indore. My talk here will be related to statin intolerance. As you know, statin are the cornerstone of therapy in reducing LDL, and various clinical trials clearly showed that statin reduces the LDL by 16 to 18%, 18 to 60% in various clinical trials, both primary as well as secondary prevention trials of statin therapy. And statins are very important, and various guidelines have now reduced the target to even less than 50 milligram per deciliter. To achieve that particular target, you require a high intensity statin therapy, but quite a good number of patients who do not tolerate the highest intensity statin therapy because of the muscle related symptoms, what is called statin associated muscle symptoms, SAMS. And because there is discontinuation of the statin therapy, and that leads to increased cardiovascular events. Now, this is called what is statin intolerance, which is mostly related to the muscle related symptoms. When the patient is not tolerating the statin therapy, that is called statin intolerance. And the prevalence of statin intolerance in the randomized control trials is around 10 to 15%, while in the it is 5%, while in the clinical scenario it is around 10 to 15%. Now, why it is low in the randomized trials? Because majority of the patients having the muscle related symptoms, they have been excluded in the randomized control trials. So, statin is a must, and it has been recommended by all the guidelines. So, what to do in those patients who are having statin intolerance? The first and foremost is of course the lifestyle modification, very strict lifestyle modification. And secondly, when the statin is required, then it is better to start with low dose of statin and then gradually build up what is called the re-challenge. So, and statin can also be given alternate day, particularly those statins which are having a long duration of action, for example, rosuvastatin. So, that you have to give alternate, you can give alternate day, you can give weekly also statin therapy. So, that is another scenario. Then there are non-statin drugs now available, which are recommended in the statin intolerance patients, for example, ezetimibe, and next we have bempedoic acid now, which is available in our country also. Then PCSK9 inhibitor, that is also non-statin LDL lowering drug, and now recently we are talking about more inclisiran, which is a long acting, just like the PCSK9 inhibitor, a long acting drug. And we have clinical trials which clearly show the clear benefit of those patients who are statin intolerant now become tolerant to more than 90 to 95% of the patients, and LDL reduction has been observed very significantly with these drugs for around 40 to 50% of the patients. So, by lifestyle modification, by alternate day dosing, by weekly dosing, we can cut down the incidence of statin intolerance, and a conversion of this lipophilic statin to the hydrophilic statin, we can also reduce the incidence of statin intolerance. And the new drugs like non-statin drugs are also available, we can use that particular drug. Thank you very much.